5:17 this morning. We know our local hospitals are reporting high numbers of COVID-19 patients right now, but what about community health clinics?
Yeah, 41 Action News reporter Bryant Madrick checked in with Vibrant Health in Kansas City, Kansas, and he joins us live this morning. Bryant, you're in an area that's seeing a lot of cases right now, one of those spikes we've been talking about.
Yeah, that's right, Taylor and Lindsay. We're in the 66102 zip code here in Wyandotte County. That's in Kansas City, Kansas. And when you go online to the Wyandotte County Health Department, they actually give you a layout of what the cases look like in all the zip codes, including the zip code that we're in this morning. That's 66102. Take a look. That zip code has the most cases right now here in Wyandotte County. Now, also right here in this zip code right behind me is Vibrant Health's clinic, at least one of the 3 clinics that they have here in KCK. And this is a facility where a lot of the people inside are working hard every single day to protect the people who are most at risk of catching COVID-19. And while hospitals are seeing a strain on hospital bed space and other resources, this facility, they're seeing a different strain.
We're feeling the strain of staffing shortages. So we've had our own staff, several of them, who have been in isolation or quarantine for either illness or contact with a person who tested positive for COVID-19.
So a lot of personal stories, not just from the staff, but also patients in terms of the impact of COVID-19, especially when you consider the number of people who have died and have become sick because of this virus. Now, I will tell you that there's a lot of work going on here to make sure that people are staying alive, but they tell me that right now the impact when it comes to this virus is not just something that's impacting patients, it's even impacting the people who work here. Back to you.
So, Bryant, we've talked a lot about hospitals and their bed situation, how many people are there. What about the clinics? Are they seeing more patients too?
No, they're not seeing more patients. Actually, it's the opposite. I'm told that there's a concern for catching COVID-19, so a lot of people are opting to stay home. But because of some pre-existing health conditions, that could be possibly a deadly outcome. And that's why the folks here, they're actually taking a proactive approach to make sure that health care needs are still met. I'll tell you what, in my next report in the 6 o'clock hour, I'll tell you more about what they're doing to make sure that health care needs are still addressed and people survive this pandemic. Reporting live in KCK this morning, I'm Bryant Madrick, 41 Action News.